I'm concerned that in your book on good energy, that you urge readers to consider psilocybin-assisted therapy. You also said that you were inspired to try psychedelics in what I can only describe as an internal voice that whispered, "It's time to prepare." Illicit drug use remains a huge problem in this country, and this didn't happen in your teen years. According to your book, in 2021, you began using illicit psychedelic mushrooms. So my questions to you are twofold. One, do you stand by what you said in your book, encouraging people to try psychedelics? And second, as Surgeon General, should you be confirmed, how would you speak to the American people about the use of illicit drugs?
Thank you so much, Senator Collins. And I also thank you sincerely for engaging so deeply with my work and learning about me. This is a very important question. And I would start by just saying that I believe what I would say as a private citizen is in many cases different than what I would say as a public health official. Joining a team where the purpose of this role is to communicate absolutely the best evidence-based science to the American people to keep them safe, thriving, and healthy. And when it comes to psychedelic therapy for mental health issues, I think the science is still emerging. And so it would certainly not be a recommendation to the American people to do that under no circumstances. I do believe that there is exciting work being done in this area that needs to continue on psychedelic therapies for PTSD and veterans, for mental health issues. And some of the researchers who are doing this work have said it's some of the most promising and exciting of their entire careers. So I look forward to following that, but to be very clear, under no circumstances would I recommend that to the American people in this role. Our illicit drug use problem in our country is monumental and severe, and I look forward to working with you on these issues that are so important.
What did you mean by saying that you heard an internal voice whispering to you saying, "It's time to prepare"?
Yeah, in that passage of the book, I'm referring to my mother's passing, which happened. She got a diagnosis of pancreatic cancer about a week after that experience. And in my meditations and prayers at that time, I was having a deep sense that something ominous was coming, and so that's what that's referring to. I think when I speak of spirituality, and I do believe Americans are ready to hear about spirituality as it pertains to medicine. 80% of Americans are spiritual or religious. There's amazing evidence coming out of Columbia University, the lab of Dr. Lisa Miller, that spirituality has a large impact on health outcomes. And, so certainly that's a personal anecdote. But I again am committed to sharing only the best solid science with Americans on how to be healthy.
I understand totally what you're saying about spirituality, and I'm sorry about the loss of your mother. It's the link to illicit drugs that I'm having a hard time with.